We're going to be beginning with an interpretive dance describing identity systems. So I hope that you're ready to get up and move around the room. I'm just teasing.
Okay.
And the other thing that I should warn you is that we're not going to be talking about underpants. So if you're thinking that you're in the underpants section, you're in the wrong place. What we are going to be talking about is a topic that probably is very boring to most of the attendees here. We have no new silver bullets in terms of biometrics or no new announcements of great technical breakthroughs. Rather, we're going to be talking about identity at scale. So if you're here because you are either operating or architecting or integrating identity systems at scale, you're in the right place. And when I talk about identity at scale, I'm talking about not only lots of people, but lots of organizations, lots of processes, lots of endpoints. So I think that the investment of your time and that of the panel will be borne out as each of the panelists provide not just a description about the particular identity systems that they have, whether it's in healthcare or in Europe or in legal identity. But what I'd like to do is to look for the common denominators, the common success factors for architecting identity systems that interoperate. Identity systems that interoperate at scale and often under a regulatory context or a legal context. And then lastly, we hope to be talking about some of the tools that architects and operators like the folks on the panel have. How do they use standards? How do they use certification? What is the trust framework that they're operating under, and how does that work in a legal and technical context? All these tools and these descriptions of interoperability are really kind of the success factors that we'll have an opportunity to share from the panelists and at the end to entertain questions from you. So I hope that topic is not it's not too boring. I believe that it really is the stuff of the identity ecosystem in general and the ecosystems that are operating and influencing our lives. So I'm going to ask each of the panelists to introduce themselves and to really describe the identity system or systems that they're responsible for. And whether it's an official title or official credentials, I really invite you to think about the panelists as perhaps job descriptions that you have as architects, people that are trying to build a house or an office park, and they have to be very conscious of knitting together plumbing systems and water systems and licensing systems and regulatory systems. So an architectural approach to interoperability in identity systems at scale is what we're all about. And we'll begin, David, with you and your description of this, this behemoth that you architected and operate today.
Great, thanks, Don. Okay, and you'll stop me when my 5 minutes is up, right?
Yeah, I'll give you a kick under the table.
Give me a kick under the table, right? We'll have a kick under the table. Well, it's good to be here this afternoon with you. My name is David Kibbe, and my training primarily is a family physician. So what I really care about in healthcare is improving the quality of care that we get. I'm an informaticist by experience, and I guess some gray hairs. I run a company called DirectTrust, which is a nonprofit that enables exchange of health information between primarily professionals in healthcare using different electronic health records. We have a very diverse healthcare system with lots and lots of EHRs that used not to be able to talk to one another or exchange information. The way it works is basically that DirectTrust enables 40 HISPs, health information service providers, who have contracts with over 400 different electronic health record vendors and 1,500 products from those 400 vendors to exchange information at 95,000 healthcare organizations in this country, including hospitals, medical practices, long-term care facilities, and so forth. There are 1.5 million endpoints in that network of networks. And it's a one-to-many system using the internet as the backbone of the architecture. We can talk a little bit about some of the standards, but the basic standard is one called the direct standard, and it's a protocol for secure transport that is independent of the vendor and is agnostic with respect to content. Now, what makes it interesting here is that overlaid on the basic transport protocol, which is SMIME over SMTP, is a public key infrastructure. So all of those 1.4 or 1.5 million parties who are endpoints have been identity proofed at LOA 3 or higher, NIST LOA 3 or higher, in some cases FBCA medium or higher. The information about that identity proofing is relied upon by a certificate authority, and we have 15 certificate authorities in our community, 2 of which are FBCA cross-certified. And then the HISP then issues a unique direct address, first name dot last name at direct.hospitala.org, and that is bound to an X.509 digital certificate, which is then used in order to both encrypt and to identity verify the parties when they make an exchange. So the first thing that happens if I'm using my electronic health record and I send you a message, that message goes to my HISP, and the first thing the HISP does is look your address up on the DNS, pulls down the certificate, identity certificate in that associated with that direct address, matches it against the anchor certificate that the HISP has in its store, and if there's a match, then it goes ahead and carries out the transaction, encrypts the document and attachment and so forth. The receiving HISP does the opposite of those transactions and eventually sends the message back to the receiving party. So counterparties are both identified and all the data are encrypted. What's somewhat miraculous about this in healthcare is that nobody has ever been able to establish a scaled trust network of this size and complexity before. The benefit here is that the hospital systems, which are generally speaking competing with one another and don't like each other and don't like exchanging information with each other very much, nor do their vendors, are able to accept and to send and receive messages and attachments at large numbers. There were 100 million such transactions in 2016, and we're on course for 200 million in 2017, without further communication with each other or negotiation with each other with respect to the security and identity controls that are trusted in order to make the exchange go forward. As long as they're part of the network, that the DirectTrust accreditation is on essentially the certificates asserting the policies and practices and standards of DirectTrust, the transaction itself is trusted and the counterparties are able to exchange at a very, very efficient level, one-to-many, without paying additional fees associated with those transactions.
David,
so let me stop there.
Yeah, that's a good stopping point. So 2 things that I'd like to suggest the audience listen for, which is this notion of a trust framework that allows these systems to interoperate. And just as a working definition of trust here, I think David described it very well, that what we're looking for in identity systems at scale is the reliability and repeatability of experience. That equals trust. We can trust that a patient, a doctor, a HISP can exchange information at a high volume and a high, high velocity because there's a trust framework in place. So we'll return again to this theme of trust frameworks. And now in a very different context, Clare is going to talk about architecting a framework in one of the most important parts of this global ecosystem for identity, which is trust in an organization, trust in an entity. And one way of expressing that trust is to have a common legal entity identification framework. So Claire, if you could talk about your experience of organizing this identity systems at scale, that would be really helpful.
Certainly. Thank you, Don. And thank you to you all for having the opportunity to be here today and talk a bit about the legal entity identifier. So my name is Clare Rowley. I manage the business operations at the Global Legal Entity Identifier Foundation. We call it short GLEIF. I'll start by describing what is the Legal Entity Identifier, or the LEI. It is a 20-digit alphanumeric identifier. It is an ISO standard, ISO 17442. The LEI and its associated reference data is intended to uniquely identify legal entities involved in financial transactions. A bit about what is this global LEI system. The system itself was born out of the financial crisis. The leaders of the G20 nations came together following the financial crisis and decided there needed to be a better way globally to identify legal entities involved in financial transactions so as to better resolve and understand interactions globally. The G20 commissioned the Financial Stability Board, based out of Basel, Switzerland, to put together the framework for the global LEI system. And that framework today consists of 3 layers. We have at the top an organization that is called the Regulatory Oversight Committee. This consists of about 70 regulators around the world who come together to promulgate the use of the LEI in regulatory reporting. We have in the middle the foundation, the organization that I represent, and we are responsible for maintaining the operational and technical standards to uphold the policy and the use of the LEI worldwide. And then we have as our third layer a group which we call local operating units, or the LEI issuers themselves. And these are organizations around the world which maintain the link to the legal entity and actually perform the services of issuing the LEI, of validating what is that legal entity that is coming in to represent itself and to have an LEI, and verifying the reference data associated with it. So today we have about 31 organizations internationally that issue these LEIs. Our prevalence where the LEI is existing is largely in North America and Europe, but also growing in Asia, Africa, and other regions. And I'll talk just a bit more about some of the regulations, perhaps, and some of the usage of this LEI that you will see. So we are growing the LEI first within our core markets of derivative transactions to capital and money market transactions. You will find in the US today and also in Europe that the LEI is used to identify counterparties within any derivative markets. And our next large growth area will be in the Europe area. There is a regulation that is described as MiFID II. It is Markets in Financial Instruments regulation, and this requires the use of the LEI across all regulated financial markets in the European Union to identify counterparties as well as those enabling the financial transactions. So that is how the LEI grows in its usage. It is through regulators requiring this. We believe that especially with the growing use in Europe, you will see the LEI continue to grow as an important identifier within the financial market space, not just for regulators and understanding and reconciling the legal entities behind transactions, but also within the private industry to use that identifier to tie and understand movements across markets and across different transactions that they are owning in their systems.
So this notion of trying to get a bunch of people that don't normally trust each other to interoperate, whether it's hospital systems and networks or international regulators, I think what Clare has done in the LEI piece is to take an important element of this emerging market of cross-border trust services writ large and begin to give some precision and some reliability and trust into who are the owners of this entity? Is this entity the one that I want to transact with? And what are the legal actions that this entity is undertaking? It seems so simple, but in these complex systems, having the precision of a set of definitions and a framework to wrap it in, I think enables the kind of scale that Claire has been talking about. Our next panelist will give us another example of organizing a team of rivals. In this case, it's in the pharmaceutical industry, and the SAFE-BioPharma organization is one of the true innovators in identity at scale, and it incorporates both individuals, but also organizations, also regulators. So Matt, if you can kind of, as Claire did such a masterful job of kind of laying out the blueprint for your organization and how it connects internally and externally, that would be great.
Sure. Thanks very much, Don. Appreciate it. And it's good to be here. Thank you. So SAFE-BioPharma is a healthcare and life sciences industry association. And we started back in 2005, where we recognized the need for these healthcare and life sciences organizations to collaborate. So whether they're doing trials or drug development, there's a number of different organizations and companies that have to collaborate together and exchange information, and also submit reports to regulatory bodies like the FDA or the EMA. And so there was a need for a standardized high assurance identity credential and also a way to do digital signatures. Okay, so we needed a close and a tight binding between an actual human and their digital identity, so that when there was a transaction going across organizational boundaries, we knew that the person was who they claimed that they were. Okay, and so over the years we've developed and evolved this standard and made sure that it complies with, for example, U.S. federal PKI requirements, U.S. trust framework requirements, and requirements over in Europe. And as those standards and requirements evolve, we also evolve our policies and our procedures for those digital identities and digital signatures, so that they can be accepted by everyone. And there's a known process for identity proofing. There's a known way that everyone knows that they can trust that digital identity or that digital signature. And what that does is it facilitates these business transactions across these organizations and allows them to perform those transactions in a digital manner, rather than exchanging paper and using courier services and things that are very expensive and very slow in today's environment, where speed is very critical in terms of developing new products and new drugs and solutions that are beneficial to the health of the public in general.
Thanks, Matt. And again, with Matt's presentation, you hear many of the same phrases or words: in-person proofing, a set of standards, digital signatures, as well as taking those different ingredients. And you see in each of the panelists different recipes, identity systems at scale. And again, you hear the same common ingredients. Matt mentioned digital signatures. David talked about building his system on top of the DNS system. So we're creating standards that interoperate, but standards that are interoperating with existing infrastructure. So our last panelist has a particularly interesting challenge in that in this notion of emerging cross-border trust services, no part of the world is more incented and is more forward-thinking than the European Union. So trying to create a single digital market, introducing a whole new context of privacy protections with the GDPR, new banking regulations, and the PSD2, the Europeans are really re-architecting identity systems with the role of the regulator and this collection of countries called the European Union. So part of what Rachel is doing is pulling together research institutions, entrepreneurial organizations, standards organizations, as well as some global leaders in identity, and try and create a new trust infrastructure for Europe. So Rachel, if you'd share with us, much in the same way that your fellow panelists have, kind of a blueprint of what the Light Test program is all about and what its intentions are in terms of driving a new framework for trust between and among those participating organizations.
Okay, thank you, Don. My name is Rachelle Sellung. I'm a researcher at the University of Stuttgart. Don said quite a bit about our project already, but it's called Light Test. We have a consortium full of both academics from different universities across Europe and industry leaders like Atos and IBM that are all working together to kind of address the concern of trust in a changing world as transactions are becoming increasingly digital. And what we would like to do is to build off the already existing trusted infrastructure, the DNS. We would like to be able to use it to retrieve and to verify different identity informations and trust services, and also to enable trust services to be able to be translated and to support delegation alongside these services.
So Rachel, give us an example. You mentioned that IBM is part of the consortium. They were looking at digital signatures. So how does that fit into this blueprint that you just shared with us?
Well, IBM is leading one of our two pilots. They are building off their already existing project of PayPal. I'm not sure if anybody's aware of it, but particularly what they're doing in the project is to use the lightest infrastructure in an implementation way of e-invoicing, and to use the verifications of signatures through the lightest infrastructure, and to use these as like a connecting of these different entities.
So your job really is to begin to experiment a bit with a new architecture around trust and cross-border trust services. It's you're at a different stage of development. You're testing different propositions out, whereas David's architecture, Matt's is a fairly maturing or on its way.
On its way.
So one thing, David, I wanted to ask each of you about, Claire, you mentioned it as well, is that if we do this right, this architecting of identity systems at scale, if we employ standards in a way that allow for that trust to occur, you mentioned before we started that a network effect occurs. Can you talk about that and why that's so important and why it's a great success metric?
Sure. So the success of DirectTrust is largely based on the fact that it is made up of people are participating in a voluntary way. No one is forcing anybody to trust anybody else. But with some government intervention and some regulations that sort of pushed them towards this, they very quickly, within a couple of years anyways, started to understand that what was powerful around health information exchange was the ability of the network to grow, and each additional node cost less money to create than the one before it, and yet the value overall increased for the network as a whole. So people started coming to DirectTrust and using Direct Exchange because it was inexpensive and more people were using it, basically. I mean, that's what a network is, right? So the primary network effect is that, and this is a key to getting people to collaborate, is that they may be competing over the services that are on the network that they offer, but they're not competing over making the network larger, more reliable, more consistent in its ability to work, and the transactions itself being more highly consistent and reliable as a product of the network growing.
Claire, is that part of the dynamic that you see with LEI, that this network effect is going to be part of the expansion of your work? As David points out, the larger the network, the more value it has. The more value it has, the more it attracts participants.
Indeed. So as I mentioned earlier, the use of the LEI today does largely grow through regulatory implementations and regulatory requirements. But you see already how we do not act in isolation across the world. Financial transactions are global and cross-border. So for example, as I mentioned earlier, we have this EU legislation going into effect. But just now, US-based companies are realizing if they desire to interact and exchange on financial markets within the EU, they too will have to get this LEI. So that then increases the prevalence within the US and also helps to lead the case for using it further within the US for regulatory implementations. I'll also mention the LEI data. It is accessible free of charge. It is collected each day by the foundation and published to our website. And getting to this idea of the network, the effect. So the LEI itself, one could say, is quite simple. It is a 20-digit alphanumeric identifier, but it is the use of that and the end user who desires to make use of that free and open data to collaborate and to build the use across with maybe within organizations or information exchanges across informations that really gives the strength to the use of this LEI. I'll also make one more mention on the idea of networks. So today, the data that is available associated with the LEI is largely what we call address information. But the global LEI system was set up to answer three questions: who is who owns whom, and who owns what. So we have just initiated a level 2 data collection, and this is the introduction of mandatory collection of direct and ultimate parents for the legal entity. So over the course of this year, with the new issuance of an LEI or with the annual mandatory renewal, information on the direct and ultimate parent will be collected, which there and of itself creates a network between the different legal entities and greatly enhances the value for the end user.
Just repeat that for me, Claire. Who is who?
Yes, so it is to answer three questions: who is who? So we say today with our basic business card information, that question is answered. Who owns whom? So who is the direct parent of a legal entity? Who is the ultimate parent? And then lastly, who owns what? And that, to a certain degree, is answered simply by the use of the LEI within financial transactions today, where the LEI is linked to an exchange or a particular product.
I'm not an economist, but my recollection of the world economy almost collapsing was partially because credit default swaps weren't regulated, and we didn't know who was who and who owned what. So this identity stuff seems to be rather important, as near as I can tell. Matt, can you talk about the network effect and how that plays a part in the growth of SAFE-BioPharma over the years?
Sure, absolutely. So, like I said before, all of these organizations within the healthcare and life sciences industry need to collaborate, right? And so when you start introducing the concept of one digital identity or one digital signature that's accepted by everyone, then all of a sudden you can have somebody with a credential from an organization over here or from a credential service provider within that network. They can access, instead of getting access to just one application that issued that credential, they can actually access all of the applications in the network. So now you don't have, instead of having, as it was in the past, maybe 100 different applications where you would have to have 100 different credentials to access those applications and trying to look those up and remember this and remember that. And the fact that those applications would have to manage each of those credentials, now you have one credential that can go to all 100 of those applications, for example. And so that saves a significant amount of time and money in administration of those credentials. It also level sets the way, as I mentioned before, each of those credentials, each of those people that own the credentials are identity proofed. And so now the applications can focus on the authorization piece. They don't have to worry about, well, is this really this person, and did they do it this way or did they do it another way? Now all they have to do is they can say, okay, now that I know who you are, now I'm going to say, yes, you can access these parts of my application or this particular content or data. And so it facilitates the exchange of information. It sets a base for just that, that initial step of identifying who the person is so that you can decide what information you're going to exchange with other organizations or with other people.
Thanks, Matt. So Rachel, as I understand it, the project that you've just kind of initiated is 3 years. Is that right?
Yes.
And then at the end of it, what does success look like? Does it have this component of this network effect, this growth? How will the testing and the pilots that you do in light test, how will it express itself in terms of success? What does success look like for your project?
What does success look like? Well, Lighthouse itself is based for a proof of concept for the European market. Mm-hmm. And it wants to be able to not only just verify trust services, but to also translate trust services, which could potentially be related to networking or effects, because you can decide as a verifier how you would like to translate each services, and this can be one-sided. So you don't need these agreements between countries of how what is translated, and I think that could be a huge benefit for networks. So if you're coming from a European perspective, if you have a U.S. driver's license and you're allowed to drive a semi, and then you want to get a German driver's license, well, the Germans can say, okay, in the U.S. we don't support that. You can only drive a normal car here. And the U.S., they have no say in it because Germany can make their own decision of how they translate it, and vice versa. So maybe this could be in relation to these networks and how people are communicating in the future, and to get rid of some of this red tape, and then also delegation of being able to verify who is actually allowed to do what, and this is also from in each individual case.
Right. It's interesting to me that, give us an example. I'm going to put you on the spot around credentials and academic credentials, because I think that may bring it to the audience about, as David was saying, is one of the objectives of his trust framework of the system is to create efficiencies, is to create cost efficiencies and effectiveness. So give us an example of the kind of inefficiencies that you've experienced and how light test might set a stage for removing some of that friction.
Okay. Yeah, you're right. That's a good way to kind of give a more applied sense of how light test could be used in the future. Okay, so I'm an American, and I studied in Germany. And I had to verify that I actually had a bachelor's degree from the University of Mississippi. And in order to do so, I needed a stamp of approval of notarization from the university, the Oxford, Mississippi, the state of Mississippi, also some regional stamp, and Frankfurt, and then Stuttgart. So this is something that could be simplified with Lighthouse infrastructure, because it could go directly to the university itself and check their list of graduates and see if I'm indeed on this list of graduates. So it could, simplify this process greatly. Another example for translations is in the US, we have a 4-point scale. A 4.0 is an A+. However, in Germany, it's a D. So they're completely opposite. So a way to translate this is, okay, so a 3.0 in the US is a B. However, this would be translated into Germany as a 2.0. So this is another way you could look at it.
So this translation function is, again, another way of expressing the need for interoperability in identity systems at scale. Claire, could you give us an example of the practical problem set that LEI might help resolve?
Yeah, certainly. So the goal of the LEI is to create the transparency and the ability to communicate across markets. So, for example, in regulatory feeds, if a regulator is aware that legal entities are entering into transactions across many different markets, there's an ability to aggregate information and understand risk positions. And then you have, from a private sector perspective, if you have today, you have many identifiers for your client perhaps, or for your counterparties across different markets. How are you sure and aware of your risk exposure to a particular legal entity unless you have a means to easily consolidate and aggregate that information? So it is with this use of the LEI consistently that institutions, be it private sector or from a regulatory perspective, are able to consolidate information to get an accurate understanding of risk exposure, as one example.
Great. I want to invite the audience to participate as well. If you come up to the microphone, we're going to ask that you have a really good question and that you articulate it so that the folks that are going to be looking at this via videotape can hear what you have to say. Sir.
I have a doozy.
Good.
Okay.
Could you tell us who you are before you...
Sure. I'm Mike McGrath with Vasco Data Security.
Mm-hmm.
Hi, David.
How are you?
I also chair the HIMSS Identity Management Task Force that David participates in, and we're also, Vasco is a member of SAFE-BioPharma. So my question is really for...
How come you're not part of my organization?
I'll work on that.
Good.
My question is actually for David and Matt. Both of you, and I was also a product manager for electronic prescribing of controlled substances, very well aware of LOA3 rules and the healthcare impact. When it goes to trust, you have LOA3 identity proofing at SAFE-BioPharma. People would come through Vasco or CSP under SAFE-BioPharma in order to electronically prescribe controlled substances. The same doctor may go through DirectTrust HISP to get a digital certificate to securely transact healthcare data. As far as identity proofing is concerned, identity proofing is a pain in the neck for a lot of doctors. And it would make a lot of sense for interoperability if somebody is identity proofed at one of your HISPs, David, or through a CSP at SAFE-BioPharma, for both organizations to trust each other's identity proofing, and then that certificate or the credential could be issued for that use case that professional would need. So that's my doozy. I'd be interested to hear what you guys have to say.
Before the panelists answer, let's ask you a question. So
Sure.
Help the audience understand why you think identity proofing is just such a pain.
Well, based on my experience, okay, so physicians going through the identity proofing process, knowledge-based authentication.
Mm-hmm.
The way knowledge-based authentication is scored, its accuracy, and its time. In many cases, that physician may not manage the household finances. They don't know that the Mercedes is leased with Mercedes. They think it's with Capital One. They score incorrectly, and they get very frustrated even before they start using the application. Okay, so you really have a low satisfaction by that end user because of the identity proofing process, because they fail identity proofing.
So I think part of what you're asking is, how do we create standards between these systems?
Trust amongst the different systems if they're at the same level of assurance, which these two are.
Yeah, so if I could,
Sure.
I'll start, David.
Go right ahead.
So certainly
Thanks,
our goal at SAFE-BioPharma is that you are able to get one credential or use a small number of credentials and use them in exactly the manner that you just suggested, right? So we are very supportive. I mean, we mentioned, what does the future look like? What does success look like? And to me, success is that if there are any credentials out there that meet LOA3 requirements, then those credentials can be used for any application that requires LOA3. So that is certainly our goal. Now, David, I guess I'll pass it over to you about the differences between the two systems. But certainly, we strive to. Part of the reason we are cross-certified with the federal PKI for our PKI credentials and certified with the U.S. Trust Framework is that we want those credentials to be able to be verified back through those systems to a common point of trust. Okay, and so when you have a common point of trust because of these agreements and the mapping between the identity proofing standards and certification that through audit to prove that those processes are followed when you issue a credential, that's how you're able to say, well, if the trust goes back to this particular route, for example, then I know that I can trust the identity proofing that was performed to issue that credential.
Well, I don't give a damn about identity and identity management and certificates or any of that stuff. What I care about is that you and I have access to our health information, which is almost impossible right now. Everybody in this room has had an experience where the inability to move his or her information or your mother or father's information or your son or daughter's information has cost you time, money, and in some cases probably some really significant health problems. That's what I care about, and that's what the DirectTrust community cares about. So I think that for me, the idea that we would start out with this grand intellectual and theoretical scheme that that's really important to have interoperable credentials for identity management is the wrong place to start. The right place to start is, what are we using identity credentials to do? And in the case of direct and direct exchange, it is essentially to force a very reluctant healthcare system and electronic health record vendors in that system to share information with one another, because it's not in their business interest to do that. Every time information about you doesn't get someplace, it means they can do another test or they can do some other procedure over and over again. There is no business case in fee-for-service for any kind of interoperable exchange of health information. So my goal as a human being and as a business person, as a physician involved in healthcare information standards, has been to make it impossible for those healthcare systems to say, no, we're not going to send your information someplace else because we don't have the standards in place, or it's too expensive, or so forth. My intent has been to make it as easy and as standardized as possible to make that happen. And oh, by the way, and I didn't know anything about this when I started out with this journey 5 years ago, this idea of identity in cyberspace is a really powerful tool, and public key infrastructure is a really powerful tool to enable trust between these parties, such that they can't say, oh, I don't trust you because you don't have high enough standards. Well, we do have very high standards. We have accreditation, we have a legal document, we have a process that enforces the adherence to those standards around identity proofing, and if people don't do it right, they get kicked out of the organization and the community. And believe me, that now costs them a lot of money if they do that, because this has now created a business environment that's worth paying some money for. So I think we're going to get the interoperability of the credentials. I think we're already seeing that happen. You and I spent an hour this morning talking. My organization is thinking about becoming a bridge certification authority. And that's stimulating a lot of that kind of talk, and a lot of that's good. But you got to really have a reason to do it. And I'm going to very much disagree of that. I'll finish with Matt. These organizations do not have to deal with one another. The only reason they're dealing with one another right now and sharing information is because you're demanding it, right? And your doctors and hospitals are starting to demand it. And oh, by the way, your taxpayer dollars put $35 billion into electronic health records in this company over the last 5 years. And the federal government said, you know what? If you do that, you're going to have to share information. So every electronic health record in this country, to be certified by the federal government to participate in this huge amount of money that's been laid out, had to have direct as a standard, and had to be able to send and receive direct messages. So it's a lot more complicated in my mind than the identity issues just by themselves. Sorry, Mike.
Well,
So,
Claire, go ahead.
If I could just clarify one
quick.
thing. So certainly in your environment, they may not want to share information. and they may be forced to do so. But in the SAFE-BioPharma environment, where there is collaboration and they do work on clinical trials and drug development together, there's a very strong desire to collaborate and share information for mutual benefit and partnership. So I just want to make sure there's a difference. What I was describing was in the SAFE-BioPharma environment, and David was
and I think it's very different from general healthcare. I think you're in an environment where there is the business. They do need to do that research, and they do need to collaborate and exchange information.
I'm going to ask Claire and Rachel to give some closing thoughts, but unlike David, you don't have to start out by saying you don't give a damn about identity. Just we'll take that as a given. Go ahead, Claire.
Certainly. So it's been quite interesting, and I'm hopefully also for all the participants to hear from. You have quite a bunch of different domains here as a background, but I think the theme here being interoperability and how even though we come from different backgrounds, actually there is overlap. And just to give a connection here to healthcare providers, well, as a matter of fact, there are payments for all of those services. And it would be nice if in the future you do see some interaction in our worlds where the legal entity identifier, as it continues to grow and be used in the financial markets, payment transactions, et cetera, there is a crossover then into the world of healthcare so that there is transparency and an ability for the users of the systems to understand who they are interacting with. So I think it is quite an interesting panel here to have together to bring together these different domains.
Well said. Rachel, you're going to have the second to the last word. So what's your kind of leave behind for the audience here about why they should keep an eye on light test?
Well, I think that in the future, as transactions are becoming more popular online or digitally, that Lightest, it's a really flexible infrastructure that's hopefully not just going to stay in Europe, but it can also be used globally, and that's our initiative, is not to just make these services easy for Europe, but to be easy for the US, for Asia, for everywhere. And not just to follow the European standards or have the option to follow European standards, but other standards across the board.
Thank you. And thanks to all of you. I hope that this has been helpful. Again, it's a bit of plumbing about how to connect systems and how to drive transactions at a high volume and velocity through these interconnected ones. I was delighted when Claire reminded her co-panelists that the identity, legal identity of an entity, of someone taking a payment or making one, is just as much of this infrastructure as anything else. I do admire David's passion for delivering services to patients, and I wanted to thank the panelists, if you could, by some applause, and thank all of you. I think we're going to have another session here soon, so I went a little bit over time, but thanks for your time and attention, and we'll see you in the main hall.